everyone, welcome to Try Right. This is Pack 365, myself Srija. Today in this session, you're going to learn about Musculoskeletal System CPT coding guidelines in a detailed way. So there are rules, these are rules, but there are not the procedures which are very important and which is used for real coding. So the first is cast, splint or traction. So all the services in the musculoskeletal system include the application and removal of the first cast, splint or traction device. So what does it mean? When a doctor treats a fracture or he does orthopedic surgery, so first cast or splint is included. So you do not code it separately. So supplies is a cast material which can be built separately. For example, fracture treatment plus first leg cast. So you have to report the fracture code only. So do not report the cast application code. And the second guideline is the cast removed by a different provider. You have to code it. So if a cast is removed by someone or other than the physician who applied it, report a cast removal code 29,700, 29,705, 29,710. So what does it mean? If another doctor removes the cast, you can bill the cast removal. So CPT codes are 29,700 for removal of the cast. So 29,705, this is the removal of the cast plus trimming. And 29,710, this is the removal under the anesthesia. So example is Dr. A applies cast. So Dr. B removes the cast later. So Dr. B can bill 29,700 CPT code. Next is replacement cast or splint can be billed. So subsequent replacement of the cast, splint or strapping during or the after the global period, it may be reported separately. So second or the later cast or splint, it can be separately billable. So it applies during the global period, after the global period. So example is first cast included. So cast becomes loose and it gets replaced. So report the cast application code. Modifier 56, it is not allowed for the cast or splint. So you cannot use the modifier 56 for cast, splint and strapping. Why? Because cast are the treatment. They are not the pre-operative management. So next guideline regarding bone graft. So code only if not included. So bone or tissue graft codes are there. They are used only if graft is taken from a separate incision. Graft is not already included in the main surgery code. So example is ACL repair code already includes the graft. So do not build the graft separately. So bone graft taken from the hip with separate incision. So build the graft code separately. And the first procedure is the fraction and or dislocation treatment. So fracture care codes usually include evaluation, reduction, first cast or splint and also follow-up care which comes under the global package. So where these codes appear? So there is no single fracture chapter. So fracture codes are found in the shoulder section, arm section, foot section, etc. So always looks under the body part involved. So how these codes are organized? So codes are categorized by the type of treatment and type of the stabilization. For example, CPT fracture codes depend upon how the doctor treats it and how the bone is stabilized. And the type of treatment, whether it's a closed treatment, there is a no incision, and percutaneous treatment, pins or wires are fixed through the skin. And whether it's an open treatment, that is a surgical incision. So types of stabilization. So fixation is by using screws, plates and rods. Immobilization by using a cast, splint and a brace. So fracture type is not equal to a treatment type. So there is no coding relation between type of fracture and type of treatment. So do not confuse the type of fracture whether it's an open or closed and type of treatment whether it's an open, closed or percutaneous. So they are not the same thing. For example, a closed fracture is a skin intact. So doctor performs the open surgery to fix it. So code the open treatment but not the closed treatment. Fracture or dislocation treatment definitions. So these are the definitions regarding fracture or dislocation treatment. So manipulation. So what is manipulation? It's a reduction by manually applying forces or traction. So manually moving the bone or joint back into the place. So manipulation is also called as reduction. For example, doctor pulls and aligns the broken bone. So doctor pushes a dislocated shoulder back. So this is the manipulation. Modifier 76 for repeat reduction. So if the same doctor reduces the fracture, bone moves again, reduces it again, you have to use modifier 76. Example, day 1 a fracture reduced and coming to day 5 the alignment lost for the patient. So it is reduced again. So you have to report the fracture code plus modifier 76. Next definition is traction. So traction is application of a distracting force to spine or limb. So pulling the force which is applied to straighten the bone, to reduce the fracture, to maintain the alignment. So there are types of traction. Skeletal traction, skin traction. So what is skeletal traction? Its a meaning is wire, pin or screw or clamp goes into bone. It's a strong long-term traction. For example, pin inserted into femur with weights attached. Coming to skin traction is a force applied only to the skin. It's a temporary traction. Example like a traction boat or adhesive straps on the leg. Next is close treatment definition. So what is the definition of the close treatment? So the treatment site which is not surgically open. So there is no surgical cut in the close treatment. So surgical cut is only allowed in the incision. So doctors does not open the skin to see the fracture. The fracture is not exposed to air. The doctor may use hands, cast or traction. So close treatment, it may be done without manipulation, without application of the cast, splint or strapping, with manipulation, with skeletal traction, with skin traction. So examples are applying a cast only, pushing the bone back into the place plus cast, pulling leg with traction. There is no surgery. So all are the close treatment as long as there is no incision. So what is the important rule for casting, splinting or strapping? They are used only for pain relief or temporary support, but they are not considered as a fracture treatment. So example, ER puts a splint. So patient referred to orthopedics later. So in this case, do not code the fracture treatment. You have to always code E&M code plus splint application only. And next definition is percutaneous skeletal fixation. So what do you mean by percutaneous skeletal fixation? It's a treatment that is neither open nor closed. So in simple words, it's a small puncture through the skin. There is no large incision. Bone is not directly seen in this percutaneous skeletal fixation. So fixation devices, they are inserted using the imaging guidance. So fixation includes pins, screws and wires. So examples are K-wires which are placed through skin under the X-ray, screws inserted without opening fracture site. This is not the percutaneous treatment. And the next definition is open treatment. So what is opening treatment? The open treatment, in this the site is opened surgically to expose the fracture. So skin is cut and incision is made in the fracture. An incision is made in the bone, in the muscle. So fracture is exposed or it is accessed surgically. So open treatment always includes the surgery through the fracture wound, enlarging the traumatic wound, internal fixation like plates, screws and rods, intramedullary nail insertion, even if incision is away from the fracture site. So visualization of the fracture may or may not occur. For example, ORIF, open reduction, internal fixation. Plate and screws are inserted and intramedullary rod placed in the femur. So all are open treatment. External fixation, what does it mean? So what do you mean by external fixation? How it is defined? So external fixation is use of pins or wires that penetrate the bone and are connected outside the body. So in simple words, metal pins or wires, they are placed into the bone. They go inside the bone. Pins are connected outside the bone using bars, rings and clamps. So the frame stays outside the skin. So why external fixation is used? Because it stabilizes the fracture, it maintains the alignment, it allows the wound care, and it is used when swelling or infection is present. So they can be temporary or a long term. For example, severe open leg fracture, pins in the bone plus metal frame outside the leg. So this is called the external fixation. Uniplanar external fixation and multiplanar external fixation. So external fixation is of two types, uniplanar and multiplanar. So what is uniplanar external fixation? In this uniplanar, all the pins are placed in approximately the same plane. So pins go in one straight direction or the plane. So they may also cross a joint or triangular pattern. So uni means one. So pins are placed from the side of the leg. They are connected by a single bar. But in the case of multiplanar, pins and wires placed in several planes with the rings. So pins go in different directions and angles. So the uses are rings, half rings, tension wires. So these are much more complex and stable. Example is a circular ring fixator and it is used in the complex fractures or limb lengthening. So can external fixation be used with any treatment? So external fixation, it may be used for closed, percutaneous or open treatment. It is not a treatment type. It is a stabilization method. So it can be combined with closed treatment, can be combined with percutaneous treatment and open treatment. So when do we code external fixation code separately? So first you have to check the CPT code description. If external fixation is included in the main code, do not code separately. If it is not included, code it separately. So external fixation codes, they are reported separately only when not inherent to the procedure. Next definition is regarding reporting fracture and or dislocation treatment codes. So what does it mean? Physician should report the fracture or dislocation code for the service provided. So code what the doctor actually did, not diagnosis only, not just the examination. You have to code whatever the doctor performed for the patient. Modifier 54, surgical care only. So if the provider will not give follow-up care, append modifier 54. So doctor performs the initial fracture treatment. He does not provide the follow-up care. So in this case, you have to add the modifier 54. For example, ER doctor reduces fracture and orthopedic doctor does follow-up. So you have to code fracture code plus modifier 54 for ER doctor. And when not to use fracture treatment codes. If a fracture treatment is not performed, you have to report an E&M code. If doctor only examines, orders X-ray, he only applies temporary splint. So do not code fracture treatment. You have to only assign the E&M service. So this is how you have to report fracture and or dislocation treatment codes. Excision or resection soft tissue tumor definitions. So this slide explains how the soft tissue tumors under the skin are surgically removed and how they are coded. So what is being removed here? These are the soft tissue tumors which are located under the skin. Under the skin means under the subcutaneous tissue. So they are below the skin but above the deep fascia, the tough layer covering the muscles. For example, lipomas, benign soft tissue masses. So what is important here? These are not skin lesions and these are not deep muscle tumors. So what is the type of surgery performed? So the procedure is a simple or a marginal excision. So this means the tumor is removed, only a small rim of the normal tissue around it is taken. So most of these tumors are benign, non-cancerous. So how is the correct CPT code chosen? CPT code selection depends upon two main things. One is location of the tumor, example trunk, extremities, head or neck. And second is the size of tumor plus margin. So you do not code only the tumor size. You code tumor size plus the smallest margin needed to completely remove it. Now what is margin? Margin is a small amount of normal tissue which is removed around the tumor to ensure the complete excision. When is the size measured? The size, tumor plus margin, is measured at the time of surgery but not before the surgery. So imaging size alone, it is not enough for the coding. What is included in the excision code? So the following are already included and not coded separately. Cutting through tissue layers, dissection or elevation of the tissue planes, simple or intermediate closure. So these steps, they are considered part of the excision. So why is not included and can be built separately? So you can build separately if documented. Complex repair, that is extensive undermining or special techniques to close the wound, vessel exploration and also nerve repair like neuroplasty. So this must be significant and clearly documented. So if the lesion is a skin origin lesion like a sebaceous cyst, so do not use the soft tissue tumor codes. You have to use skin lesion excision codes, that is 11,400 to 11,446 code range instead. This is about excision, resection, soft tissue tumor definition. And next is excision of facial or subfacial soft tissue tumors. So what type of tumors are these? So these tumors are located within the fascia or below the deep fascia. So fascia is a strong tissue layer covering the muscles. The tumor does not involve the bone. So these are the deeper than subcutaneous tumors but not the bone tumors. So what are the common characteristics of these tumors? They are usually benign. Benign means non-cancerous. They are often intramuscular, inside the muscle. They are removed with the minimal normal tissue. So these are more complex than the superficial tumors because of the depth. So depth matters a lot in the coding. So what type of repair is included? Simple or intermediate repair is included in the excision code. So there is no separate billing for the routine closure. Now how is the CPT code selected? Code selection depends upon the location. For example, trunk, upper extremity, lower extremity, head or neck. So what is the size of the tumor plus margin? So you measure the greatest diameter of the tumor plus smallest margin needed. So the margin is based upon the surgeon's judgment. So when is the size measured? The size tumor plus margin is measured during the surgery. So preoperative imaging size alone is not enough. So what does margin mean here? Margin is the smallest amount of normal tissue which is needed to fully remove the tumor, and also it prevents the leaving tumor behind. So these are not wide margins like cancer surgery. What is included in the excision code? These are not built separately. Dissection of the tissue layers, elevation of the tissue planes and accessing the deep tissue to remove the tumor. So these steps, they are considered a part of a excision. So what can be built separately? Only if clearly documented. Vessel exploration, nerve repair like neuroplasty and complex repair like extensive undermining. So what are digital subfacial tumors? So digital is fingers and toes. Subfacial tumors, these are the tumors that involve deep structures such as tendons, tendon sheaths and joint capsules. So if the tumor invades or involves these structures, it is a subfacial. So if the tumor only touches them but does not break into them, it is considered as subcutaneous but not the subfacial. So depth is decided by actual involvement, not just closeness. So what is radical resection? Radical resection means removing the entire tumor plus a wide margin of normal or healthy tissue around it. So this is done to reduce the chance of tumor cupping back. So it ensures the complete removal, especially in the aggressive tumors. So always compare a simple excision and a radical resection. So simple excision, it removes tumor only, whereas radical resection, it removes tumor plus extra normal tissue. So what is not included in the radical resection, which is built separately? So if the surgeon does any of the following, they must be reported separately. Blood vessel exploration or repair, nerve repair, that is a neuroplasty, or reconstruction such as tissue transfer, flaps or grafts. So these are reported separately. Wound closure and repair. So if the wound is small and closed normally, it is included in the radical resection. If the wound requires extensive undermining, complex closure techniques. So this becomes a complex repair which is reported separately. Next guideline is dissection of the tissue planes. So dissection is a cutting through or lifting tissue layers to reach the tumor is a part of the excision. So this is not coded separately. Access work is bundled into the main procedure. And tumor depth versus tissue removed. So how do you compare it? So even if a tumor starts in one layer, for example subcutaneous, radical resection may remove tissue from multiple layers to get the safe margins. So coding is based upon the extent of resection, not just where the tumor started. So when is radical resection usually done? This is most commonly used for malignant soft tissue tumors and very aggressive benign tumors, which is a high recurrence risk. So aggressive tumors, they need wider margins to prevent the recurrence. So how is the correct CPT code selected? So CPT code selection is based upon the location of the tumor, the size of the tumor plus margin. So greatest diameter of the tumor plus the margin needed for complete removal. You have to measure. So what does margin mean here? Margin is a normal tissue removed around the tumor. It is determined by the surgeon's judgment. So measurement is taken during the surgery, not before. For simple excision, there is a norm margins, and for radical resection, there is a wide margin. What is a radical resection? It means a tumor is removed and large amount of surrounding normal tissue is also removed. It is done when tumors are aggressive, malignant and high risk of spreading. So for example, for melanoma, you have to use 11,600 to 11,646 codes. The codes under integumentary system. And bone tumor excision, which is an important concept. Bone tumor excision, it involves removing of the tumor, taking wide margins of normal bone or tissue. Simple or intermediate repair is included. So these are much more extensive surgeries than soft tissue excision. So what procedures are not included and can be billed separately? So if documented, you can code separately the vessel exploration, nerve repair, complex bone repair, reconstruction of the tissue transfer and flap procedures. So this requires separate CPT codes. And wound closure and repair rules. Extensive undermining or advanced closure comes under the complex repair. So complex repair is coded separately. Simple dissection to reach the tumor is not included in these codes. And what are the extreme cases? The entire bone removal. So if tumor growth is very extensive, the entire bone must be needed to be removed. For example, clavicle, collarbone removal. So this represents a major oncologic surgery. And what if surrounding soft tissue is also removed? So during bone tumor surgery, some of the soft tissue around the bone is often removed. So do not report the soft tissue radical resection code separately. The bone tumor resection code already includes the removal of nearby soft tissue. How is the CPT code selected for bone tumor resection? This is a very important exam point. So code selection is based only on the location of the bone, but not based upon the size of the tumor, whether it is benign or malignant, whether it is primary or metastatic. So the location examples such as femur, tibia, pelvis and clavicle. So why doesn't size matter here? Because bone tumor surgeries are standardized by anatomy. So the complexity depends upon which type of the bone is involved and surgical approach. So size and diagnosis do not change the CPT code. So these are the definitions of the procedures which are involved in the musculoskeletal system surgery. So this is for today. I hope the session has helped you. In the next session, you are going to learn about the guidelines and how the codes are organized within the musculoskeletal system surgery section. Thank you.